So the big three actions have been the defunding of UNFPA by the United States, the threat of funding cuts. Funding cuts haven't actually happened, but the president's budget zeroed out international family planning for the first time in history. And then the global gag rule and the expansion of it to all of global health assistance, so about 15 times the pot of money that it was previously applied to.
Raise awareness on what is happening, because a lot of organizations don't know, for example, how to respond to the global gag rule, which is implemented by the US administration, and what it means, who it affects, how it affects young people as well, how it affects a non-profit organization.
The first action I will do, that I hope we all do, is stand up and speak out. I think the big risk we run is that the world of a global gag rule, the world of increased opposition, the world of negative populism will become the normal world, and we have to do everything we can to make sure it is not normal, that we do not accept these cuts, that we do not accept this treatment of women and girls, and that we continue to fight the good fight so we see a new normal where girls and women are free.
One of my main messages was really to make sure that our partners, both CSOs here at Urongos and then in country, are prepared and working to mitigate against some of the harmful policies that are coming out of the US, threats to funding, implementation of the global gag rule, and defunding of UNFPA. We're moving forward. This President Trump, when he came in, he moved forward with a very expansive global gag rule policy. And now we're working to make sure that partners understand what that policy is, how it's going to impact their work, what they're actually agreeing to. We're working against threats to funding cuts, in particular a complete zeroing out of funding for family planning and reproductive health, which President Trump supported, and then really working to talk about what a defunding of UNFPA means. UNFPA gets about $70 million from the US government, so that money goes to humanitarian response and also their core work of UNFPA.
We can't let this divide us, because that is its intention. The Mexico City policy will eventually mean that some people are in and some are out, some get money, some don't, some won't, and of course the US government is reaching far beyond its national borders, interfering internally in people's affairs, even where things like abortion are legal. So we have to be sure that we don't let that happen inadvertently. We heard from a colleague in Mozambique that his organization, he's a member of the IPPF group, and his organization is going to be starved for funding because they will not sign. So absolutely find ways to support them. Material ways, financial ways, policy ways, campaigning ways. So support those who are delivering services and serving women and young people. That's for me the most pragmatic way. And then educate and inform and do your research, have your numbers, be able to say in specific terms how the gag rule impacts real lives, and speak to the heart as well as the mind in this process.
What we can do in the U.S., I mean, we're working on it just around the clock at the moment, sort of looking at compliance and how we can make compliance as easy and restricted as necessary, so we're not over-complying, we're not doing the work of the government, and really encouraging implementers to hold the lines where they can. And we're also really looking at all the different ways we can mitigate harm, encouraging organizations to seek exemptions, a slight hole that was left in guidance from the U.S. government, encouraging groups to think through what activities they can and should continue, post-abortion care, provision of abortion, and counseling and referrals in the cases of rape, incest, and life endangerment. Those are not included and can continue unimpeded. And then really, for the Europeans, I think there's several pieces. One, just being, I heard our panelists talk about resilience so much and helping support the civil societies that need to weather this storm, knowing that it's a hard choice to sign or not to sign. And all those groups need empathy, really, about as they try to make the best decisions for the people who use their services or the people they're advocating on behalf of. So I think the European civil society and donors have a huge opportunity to be that space of empathy, being safe spaces. I heard one of the panelists talk about the role that the EU can play in countries to continue to be a source of information, very accurate information about how to limit the harms, and also physical space for groups to still meet.
I think what Europe can bring is strong political support for sexual and reproductive rights and health, and what they can bring is the introduction of a new normal. They're one of the strongest blocs I think we have globally that can actually stand up to the US and say that these cuts are not acceptable and that we want something different for the women of the world.